Doreen Granpeesheh is the
Dr. Doreen is an expert in autism.
Doreen Granpeesheh.
Dr. Granpeesheh.
Dr. Doreen Granpeesheh.
Dr. Doreen Granpeesheh is a visionary in the field of autism. Now you can ask her questions on Ask Dr. Doreen. Now, Sade has written in and said, any advice on how to stop licking? My child started this behavior licking their hand and wiping the saliva all over their face. The behavior started with a series of colds and now continues, although they are well. They also like to use a wet washcloth as well, if not licking.
Yeah. I love that. Human behavior is so incredibly complicated. And initially we're like, okay, well, we just have to, prevent the child from licking and all that. But before I give you an intervention, I guess I'd like to learn more about this wet washcloth thing as well, because to me it appears, and like this is where if I knew your child, I'd be doing what's called a functional behavior assessment, so I could identify exactly what is the function of the behavior. Our kids will develop these little behaviors and we're always like, well, that's an odd behavior, I should get rid of it. But before you get rid of it, you kind of should find out what is the function of it. What is he trying to do with it? What is he replacing, or what other need is being met by this behavior? And so
we always say here, what's the paycheck? He's getting a paycheck for it. What's his paycheck? Let's not take away his paycheck.
Exactly. There's some reason that this started, and it could have been something like he had a cold. It could be so many different things. I'll give you a couple of ideas. So, he had a cold. From the cold, his nose became very dry, or his lips. And then he figured out that something like a wet washcloth or a saliva in that area will now remove the dryness feeling, and it feels better because it's not dry. That's one option. Another option is he had a cold and his nose was running, and you'd come up and wipe his nose a lot. So he got a lot of attention from you. And now he's thinking, maybe what I have to do is make my whole face wet so that I can get mom to come over again. Yeah. So we kind of have to figure out exactly sort of what led to the behavior. So maybe you can help me with that. How did it develop? What were the things that you saw coming up when he had the cold? And what in your behavior, what changed? So like when he had the cold, what started happening? Was he getting a lot more of your time? Is he getting a lot more of your time right now by doing this behavior? So what we're trying to figure out is, was it an avoidance type of behavior, a tangible? Is it access to something like the wet washcloth? Is it access to attention from you? Maybe you can give us a little bit more information.
Yeah, because ultimately, when we figure out what the paycheck is, then you can figure out what to put the replacement with.
Exactly.
I think that's the part that as parents, we don't always go, oh, that's why I need to know that. Because if it had a paycheck and I give it a replacement, we're not going to have some big push me, pull you trauma over it. We've met the child's needs. It's what's fair. It's what we started with, what's fair. But if we try to say, oh, you're doing that and you're doing it for a reason, now I want you to stop, good luck with that.
Yeah.
You're not going to have a good time with that.
Well, and you stop in different ways, right? It's like if it's, and I see that Shade's writing in again saying that he was having mucus from his nose, I think is what she's saying, and that she was cleaning it with a washcloth. But she has a feeling that it was a sensory seeking behavior. And there you go. And that in itself is very important. And if you feel that he has a sensory need, now she wrote back in, which is a whole different thing. She wrote back in and said, the paycheck I thought was me telling him to stop. So let's try to correct this and keep both of those things in mind, because so what you're saying is maybe part of it was that he was getting a kick from it because he was getting your attention. Negative attention is attention. It doesn't matter. So part of it is that. But then the other side you're saying is that he also enjoys the sensory aspect of it. So let's provide him the ability to have some sort of sensory thing going on, and let's remove you from the equation. Let's do both of those things. So yeah, I'm just looking at exactly. So he has dry skin. So that's actually wonderful. And so one of the things that you can do is just stop telling him to do it or not do it. Let's just stop intervention, any kind of consequence from you when he does this. But let's put him on a schedule where he, I don't know, maybe depends on whether he's home or not, but at certain intervals, like every 2 hours, can you just out of the blue go over to him and take him to a mirror and put some lotion, show him how to put lotion, rub his hands and rub it on his face. So let's teach him to start putting an appropriate lotion, especially since he's also prone to eczema, on his face, and then to walk away from it, and then you go about doing, just moving on. And the frequency at which you want to do that is basically, hopefully, something that's manageable throughout his day. Like a lot of people, my husband being one of them, also because he has these allergies, will have like a small lotion with him. He also used to have a ton of eczema from allergies, so he has it's just a habit now where he will put lotion and put it all over his dry spots. Let's start by doing that, and please track it and let us know if the other behavior, which was spit and running, starts to go down. Try not to get too involved with him when he is putting spit. What I would do, instead of saying don't do that or something like that, is I would just move his hand away and interact with him with some other type of activity. So basically distract him to something else, but don't verbally respond to him or consecrate it. And let's see if actually having moisture and having this sensory need met will now eliminate the other way that he was meeting his sensory need.
If you found anything helpful in this video, please give us a like. In fact, make sure that you smash that subscribe button on YouTube and give us a like on Facebook. You can also follow us on Twitter and Instagram for important updates. And please download our free podcast wherever you get your podcasts. See you next time. Until then, give your kiddos a hug from me and one for you too. Bye-bye for now.
To subscribe, click here. And if you'd like to check out some more of our videos, click here.